Hey everyone, I'm here at Advent today and I'm going to take us through a new patient appointment. Come with me.
Hello. Hi.
How are you?
Great. How are you? Good. And Advent.
Thank you.
Checking in from Yes.
Great. Stay down. Molly, you're a physician's assistant here at Advent, and I'm so excited to meet with you today because I want to show everyone what it's like to have a first appointment here, because people, I feel, deal with issues with sleep and snoring their entire life before they come see someone like you. So what will someone expect when they first come in?
Yeah, here at our clinic we do new patient visits. They're usually about 30 minutes long, and we really focus on listening to the patients. A lot of our patients have had symptoms 5, 10, sometimes lifetime, and they feel like in the past when they brought it up they might not have gotten any answers or felt validated with their concerns. So we always listen to our patients, hear what's kind of going on, and we do an evaluation as well.
Mm-hmm. And one of the things you do an evaluation of is this thing called the breathing triangle, right?
Yes.
That's what we need to know.
Yes, the breathing triangle. So you only have 3 ways for air to get in. You got 2 nostrils and you got your mouth, and it makes a triangle. So if like 2 of them don't work, like your nostrils, that's affecting how you're breathing. So we always evaluate your breathing triangle. We talk about that because it's huge.
Yeah, absolutely. I feel like you guys are different than regular ENTs because you have this specialty with sleep and with snoring and actually getting to the root of the problem.
Yes, so we're not a general ENT practice. We do focus on sinus. We focus on snoring and sleep apnea. We also take a nasal approach. So we focus on the nose first. What's going on with the nose, because that affects other things like sleeping. And people don't always realize how it can affect your sleep quality.
Do you think it's usually the person coming in for themselves or their partner suggesting they come in? Because I feel like this is a marriage issue too.
Oh yeah, sleep divorce, real thing. I have quite a few patients where like, I just want to sleep in my bed. Like I don't want to sleep on the couch. I keep getting elbowed all night long. And sometimes they bring their spouse with them and they're sitting in the corner and be like, yes. And you didn't talk about that.
Right. That's so true.
Yeah.
Well, and that's what I love what you do, because you ask the goals of the patient. That I think is something so different than a lot of ENTs do. They just kind of like, you follow their route.
Yeah, no, we always ask on the first patient visit, what is your goal? You know, is it, you know, you just want to sleep in your bed with your wife, or is it, you know, you have sinus infections multiple times throughout the year and it's really affecting the quality of your life, where you're sick a lot of the time, things like that. So we get that goal and we always focus on that goal as we create our treatment plan.
Well, I love that you can do that. Even if it's allergies, you can still work on things that help. So the evaluation of the breathing triangle, how does that work? Because I know you've got a little tool that you can use.
Yes, so do you mind if I do an evaluation on you?
Sure.
All right, so I'm gonna look at your throat first.
Okay. This can all happen on the first appointment?
It does, yes.
Okay.
We evaluate everybody on the first appointment. So have you open up wide, say ah for me. All right, good job. And then this is called our nasal endoscopy. And so what this is it helps us get a better look at your nose.
Okay.
So we can see, you know, do you have nasal polyps? What does your septum look like? Are your turbinates okay? So I'm gonna spray your nose with some spray. So this is lidocaine and Afrin. So it doesn't taste the best, but it's safe to swallow.
Okay. Good, because I swallowed a little.
No, you're fine. You're fine. This whole thing is not going in your nose.
Okay, good.
It's just a bit of it's going in, and I'll just kind of talk you through what I'm looking at, okay?
So you can see things in my nose and throat when you do this?
Yes, things that I wouldn't be able to see if I just took a speculum and looked in your nose.
Okay.
So what I'm looking at right here is I look at your septum. I just make sure, you know, is it deviated to one side? I'm looking at your turbinates, which are tissues that moisten and humidify the air. And then looking further back, looking for any polyps in the back. I look all the way back to the back of the throat and then down to your vocal cords. All right, and then I do that on the other
That was
side as
it?
well. Yeah.
Do you see anything?
You know, you don't have polyps. Very glad about that. But I'm looking at everything, your turbinates, all that stuff, and how it contributes.
Okay.
So that's part of our breathing triangle. So we're looking at the nose, looking at that mouth.
That's not bad at all. Well, especially since it's numbed, there's really no sensation beside, you know, just someone being close to you and seeing that. So once you see something like that, then what can you determine from that? Would you do another appointment, or would you be able to tell me right then and there maybe some issues? Because I think a lot of people don't expect to get answers in a first appointment.
So yeah, we do tell you, what's going on, what does your nose look like, why do you think you have this drainage, or snoring, is the nose connected to that, or what's going on? So depending on what your goal is kind of how we create our treatment plan. If you're dealing with snoring, we always evaluate you for sleep apnea by doing an in-home sleep study.
Okay.
If we're thinking there's sinus stuff or your nasal complaints, things like that, then we may head towards a CT scan. We do those in office. We may try some different medications to see if that can help the symptoms. So we always do a follow-up appointment based on what you need and what your treatment plan is.
It seems like a super simple process. And I think that's what people want, right? Because they probably come at a point where they feel like they've tried everything else. They've tried the nasal sprays, they've done everything, and they just can't get relief.
Yeah, and it is. It's a simple process. It's simple to be evaluated, 30-minute appointment. I mean, a lot of patients have been standing in that aisle in the pharmacy and they're like, tried that, I've sprayed that stuff, I've tried this stuff, like I've taken these pills, like what else is there?
Absolutely.
And we offer that, like what else is there? Was there simple options to make your quality of life better?
What do you hear patients say after they've done even this evaluation? Because I feel like even just doing that, I feel like I have more information about my own situation. So I'm sure you hear a lot of great responses.
I really do. I really hear a lot of like, oh, that's it? Or like, oh, that's why that spray didn't work? I'm like, yeah, that spray didn't work because of this, or your septum's so deviated that, that's what's obstructing that side of the nose.
Super simple. So Molly, thank you so much. If people want to come see you, they can do a quick evaluation or sign up for a consultation online, right? It's so simple.
60 seconds. Takes you 60 seconds to go online. We have multiple different clinics throughout Wisconsin, even in Illinois. So you can go online, sign up for an inpatient visit, and come see us.
Do you have to have a referral?
No, you don't.
All right.
Nope, just come see us.
That means there's no excuses.
No, there really isn't. There's really not.
Thanks so much, Molly.
You're welcome. Nice to see you today.